Anatomy is the study of body structure while physiology is the study of body function. They mutually influence each other. Anatomy is the basis for modern medicine and for massage therapy. The human body is composed of 10 organ systems if urinary system and reproductive system combined as urogenital system. Generally, there are 11 organ systems, 12 for both male and female reproductive system, among which the skeletal system, muscular system, integumentary system, circulatory system, and lymphatic system are the key systems not only because they are the framework of the body structure, but also because they have the direct relation to massage techniques. However, the nervous system, digestive system, respiratory system, endocrine system, and urinary system manifest the effect of massage primarily through reflection of nervous system. Human body structure. The understanding of the human body needs to establish a series of standards to prove the unified recognition and avoid misunderstandings. The most important one is the anatomical plane and anatomical position for the establishment of the consequent conceptions. The human body is a three-dimensional structure composed of 3 anatomical planes as sagittal plane, median plane, which divides the body into left and right, frontal plane, coronal plane, which divides the body into anterior and posterior, horizontal plane, transverse plane/axial plane, into superior and inferior. The anatomical position is the default setting of the observed body known as erect body, feet flat pointing forward and arms at side of the body, palms facing forward and finger pointing down. Palms facing forward are the most important portion of the anatomical position because only in such a position the ulna and radius bones of the forearm are in parallel and not cross-overed. With the anatomical position and planes, the conceptions of medial and lateral, proximal and distal are identified. The medial side means the one close to the median plane while the lateral side is away from the median plane. In the MBLX test, the medial side directs into the bone of ulna and tibia while lateral into the bone of radius and fibula, respectively. The proximal part means the body extremities close to the body trunk while the distal part means away from. For example, the hip is proximal because it is close to the body trunk while the ankle is the distal. Elbow is the distal part while shoulder is the proximal. The body can be separated into 2 parts, the central body region, and limbs. The central region is the main part of the body excluding the 4 limbs. It includes the head, neck, and body trunk. The body trunk can be divided into thorax, chest, abdomen, and pelvis. The body limbs are upper ones, arm, forearm, wrist, and hand, and lower ones, thigh, leg, ankle, and foot. There are many body cavities which contain the important organs such as cranial cavities and spinal cavity which contains brain and spinal cord respectively and called together dorsal cavity. The ventral cavity includes thoracic cavities which contain lungs and heart, abdominal cavity for most of the digestive organs such as stomach and intestines, pelvic cavity for reproductive organs. The diaphragm, a thin and parachute-like skeletal muscle, is the natural border line which separates the thoracic and abdominal cavity. Because the kidney is in the abdominal cavity, the abdominal pain is not only due to the problems of the digestive organ but urinary issues like kidney stones as well.